I think it's a good habit to get into is to use some sort of sunscreen daily. We think about, people are often very good about putting sunscreen when they go to the lake or they go to the beach, but we forget everyday life we're exposed to ultraviolet light. Most of our car windows and our house windows let in a proportion of ultraviolet light. So I think getting in the habit of putting some sort of sunscreen on and a moisturizer in the morning is important. But if we're outside, that's probably gone by middle of the day. So what you want to look for is something that is broad spectrum, meaning that it equally blocks UVA and UVB rays, which not all sunscreens do. Sometimes they only block UVA rays. So you want a broad spectrum sunscreen, and for skin cancer reduction, SPF 30 or greater is what's recommended. So it's important to apply enough and then to make sure you're reapplying it. They make sweat-proof and waterproof ones, but on the bottle it'll say 40 minutes or 80 minutes. And at that 40-minute or that 80-minute mark, it's lost its effectiveness and you need to reapply it. It's important to know sunscreen doesn't block 100% of UV rays, even if you get an SPF 100. So it's still important to really be smart about our sun exposure, especially when we're in those peak hours of 10 to 4, when the ultraviolet ray exposure is greatest, or if we're outside for a long period of time. So using sunscreen, but also trying to get some shade, cover up if you can, and especially if you're at higher risk, to make sure we're using all of those preventative measures. There is no upside to tanning beds, especially when we talk about skin health and developing skin cancer. Tanning beds expose you to UVA lights, and several of them also expose you to UVB lights. Both UVA and UVB rays have both been linked with the development of skin cancer. In addition, UVA rays that the tanning beds predominantly composed of and emit are what we think of causing skin aging and skin damage and wrinkles. But I think one of the misconceptions is people like to tan before they go on vacations because they say, if I tan, then I don't burn. But what we have to recognize is that the tan is also damaging the DNA in our skin. So although burns, and especially blistering sunburns, are worrisome, even just the run-of-the-mill usual sun exposure that we think about with tanning our skin is also dangerous. This is impacting girls, boys at a young age, and that's when our skin is especially susceptible to this damage from UV light. So we really need to, I think, not only get the word about skin safety, but I think we need to really change our perception of what's healthy skin and what's appropriate and what we should look like. And I think that message has to start when you're young. Not only can we reduce the risk of skin cancer, but we can reduce the signs of aging that come from sun exposure. But this really all has to start at a young age. We know that ultraviolet exposure through tanning beds and sunburns especially has great impact when we're under the age of 30.